Welcome to the Happy Home Birth Podcast, your source for positive natural childbirth stories and your community of support, education, and encouragement in all things home birth and motherhood. Raise your hand if you've experienced a symptom or two in pregnancy that you wish you could get to the root of and heal. Food aversions, morning sickness, full-on hyperemesis gravidarum or HG. Hey there, happy home birthers, and welcome to this week's episode of the Happy Home Birth Podcast. I'm your host, Caitlin Fusco, and this week we are speaking to Jes Reynolds, a holistic health practitioner and founder of The Wellness Element, where she guides mothers to protect the health and well-being of children by reclaiming their intuition and sovereignty in pregnancy and motherhood. After healing herself from autoimmune illness and reversing her own HG, Jes now supports women worldwide through her signature course, Healing HG Blueprint. Her work weaves together biology, nutrition, detox, and ancestral wisdom to address the root causes of pregnancy complications. She is passionate about transforming the cultural narrative of pregnancy from one marked by fear and medical control to one of initiation, power, and remembrance. Through education, advocacy, and community, Jes equips women to fiercely safeguard their children's health from preconception through postpartum. Jes is going to share with us her own story and experience of pregnancy and birth, along with how she works with mothers to prepare deeply for pregnancy to avoid nutritional depletion, heal trauma and the nervous system, and have the healthiest experience of pregnancy possible. Let's jump in. Please remember that the opinions of my guests may not necessarily reflect my own and vice versa. And this show is not medical advice, it's an educational tool. So continue to take empowered responsibility for your health and your family. Jes, thank you so much for coming on the Happy Home Birth Podcast.
Yeah, thanks so much for having me. I'm excited to be here.
Oh, I am so excited for you to be here. I love talking with people who like to find root causes of health issues. So when we started talking, I was like, oh my goodness, she's going to be perfect for the podcast. And so many women are going to gain so much information from what it is that you have to share. So before we get into all of that, would you mind just taking a moment to introduce yourself, your family to the listeners?
Yeah, so my name is Jes, and I am the founder and the face behind the Wellness Element. We are currently in a little bit of a rebrand, so we are going to be positioning ourselves a little differently soon. So you'll find us under a different name, but announcement on that to come. And I really got into this work by, having firsthand experience about it and having the unfortunate experience of having HG myself. But prior to that, I really was someone who was passionate about root causes. I had an autoimmune issue, disease. I don't know what you want to call it. I don't really like to characterize it, but I spent years going to the doctors trying to figure out my symptoms, why I went from being an elite level athlete to needing to nap after vacuuming, really in a quick turnaround. And I got nowhere. So 2-3 years of every specialist, everything, they just kept looking at me saying, well, you're young, you're not overweight, you look healthy enough, like come back to us when it's worse. And so I had to learn root cause, teachings on my own. I ended up taking a nutritional therapy diploma. I've studied in the field of epigenetics, and I just started diving into self-study in a way that I thought was going to help heal me, and it did. And then I was able to help heal others in my friends and family and people that, I had around me. I was working as a clinical physiotherapist at the time, and I started seeing different things in my clinical practice as well, where I'm like, this is not simply a shoulder injury. Now that I know traditional Chinese medicine and I've taken my acupuncture, I actually know that this is the referral pattern for the liver. And so there's something inside. And it was just this, the body is bigger than we're giving it credit for in this one area of like what I focus on. And yeah, that's just sort of expanded to the point now where I kind of study the body, I guess, in general. And then the application to pregnancy really came about from my pregnancy and my HG experience.
Wow. I know exactly what you're talking about with having symptoms and trying to get to the root of them, and everyone basically just being like, yeah, no, you're fine. Like, this is fine. You seem okay. But
Yeah.
you, like you said, oh my goodness, that was a perfect example of being exhausted after vacuuming. That was the life that I was living a number of years ago as well. So I can completely relate, and I'm so excited to hear all of the information that you have to give our listeners. But let's go ahead and jump into your story though, because like you said, that is how you kind of got off on this specific trajectory, working with pregnant mothers and pre-pregnancy as well. So what was your pregnancy journey like?
Yeah. So, I mean, it makes me laugh when you ask me that. I had a pretty rocky beginning, obviously, to my pregnancy. Being a first time mom and first time, going through everything, you don't really know like what is normal. You're not seeing a care provider necessarily. And especially if you're someone a little more holistic, you don't really want to have a bunch of interventions and meddling and opinions and thoughts, which was sort of how, I didn't think that this was a medical condition to be managed. Although I also was experiencing sort of this, I don't know if this is normal and I don't really know who to ask or who's going to help support that. So that was really the experience for me in this. And I think from that, I just started to try to learn as much as I could. I already had a master's in anatomy and physiology. And through my pregnancy, I hired an amazing doula. And it was just a journey of like learning to apply what I know about the body to the experience of pregnancy now. Now that was challenging when I was face in the toilet for 10, 15, 20, 30 times a day of being sick.
Wow.
But there were windows and there were moments that it was better. It wasn't always that consistent. And I ended up having sort of a similar experience with the medical system where I would go into hospital. I would be like, I just need IVs. I've thrown up 30 times today. I haven't been able to keep anything down. Like, that's all I need. Give me this like little reset and then I can be out of your hair. And, after the third, fourth time, they were like, well, we gave you prescriptions. Like, are they not helping? And I was like, well, I haven't really taken them. And they're like, well, why not? And I said, because you don't safety study on these, and I'm not willing to be the experiment. And I understand that I obviously need to sustain the pregnancy in some way. But, that is just, it doesn't really feel good for me to test these out. And he said,
Mhm.
oh, I understand, but we think this one's okay. We think Zofran's okay. We think diclectin or diclegis is okay. We've been using them for a long time with pregnant women now. And I know we got some things wrong, like the x-rays and the thalidomide. These were his like exact sentiments. But we're pretty sure this is good.
But it couldn't happen again.
This is not really good enough for me. Sorry. So, yeah, I kind of had these moments where I was like, when I took the medication, it did help. So it was doing something in my body. And I just had to flip that switch of like, I did it once before with my autoimmune issues. I solved that. I can do it again. And I just need to kind of think like an engineer on this. So it became, if I know that this is fixing the problem a little bit, then what are the possible problems it's fixing? And like, how can I
Mhm.
reverse engineer that? So yeah, I really sort of worked backwards from that to try to figure out, what was at play here for me. And fortunately, I was able to. And I went from, just the week prior throwing up 30 times in a day to, being sick once on the third day once I implemented my plan that I had created for myself. And then I was never sick again the rest of the pregnancy, which really allowed me to prep and prepare for the home birth that I wanted to have, although there's more to that story as well.
Mhm.
But yeah, that was really it. It was about determining what my root causes were, seeking the knowledge and the information from different people that I trusted in the holistic space through Instagram, making a plan that I felt was individualized to my body, and then enacting it. And it worked like a charm.
That's amazing. That is so exciting. And I love the idea of, okay, this medication is fixing these symptoms. Like there's something going on because this medication is actually taking care of the symptoms. So, what could be the underlying issues that would cause the symptoms in the first place that I could actually heal? I love the way that you reverse engineered that and figured that out. Incredible.
Yeah, and it was really similar with my autoimmune issue too. It was like, I think I had either Hashimoto's, lupus, or Lyme disease. And it's like, if I
Mhm.
have one of those, what are the symptoms? What treatments? Are there any treatments that are common between all three? And what if I
Mm.
just start there? Because then it doesn't matter which one it is, because if the treatment is going to positively affect all three, then I'll just take a step in that direction. And I just sort of moved like that throughout both journeys, as a step by step in the direction that I felt like was most applicable to the symptoms that I was experiencing.
Wow. Yeah, that's incredible. So once you reach this spot where you were able to function, that's great.
Yeah.
That's a big deal. That's a huge deal when you are unable to function. You reach
Yeah.
this place where you're able to function. What was the rest of your pregnancy like? And then leading up into that, your desired home birth?
Well, I laugh because you're like, tell me about your pregnancy journey. And I just want to like spit out that I was probably the most hated client that my midwives have had to deal with, because it was all rooted in my intuition, in my gut instinct, in research.
Amen. Get it, Jess. Get it.
So I think the rest of my time was just self advocacy, honestly, because I had a really medicalized midwife team. And I didn't know that necessarily at the time, right? You're kind of going through all of these things with only one lived experience to kind of compare, well, nothing to compare it to. So yeah, I remember, obviously this is through COVID times. This is through this uptick in wanting to vaccinate maternal women, and me just having to argue at every stance. Every time they would propose an intervention, I would say, what happens if this is negative and what happens if this is positive in terms of the test result or whatever. And then if the next step was not something I was willing to do, I didn't even do the first one, because it just gave me this disconnection from my body. Every time, I did have a 20-week anatomy scan, and I remember feeling so anxious and nervous going up to that scan, being like, what if something's wrong? What if they see something? What if I have to have all these tests? What if? When that was removed, it was only my intuition and my body, and everything felt fine. Right. And it's like we can override our own intuitive instincts because there's these external measures that are going to tell us how we feel. And granted, there are times where that's helpful, but largely
Mhm.
it's not. Right. And it's just monitoring. And it's every time I declined an intervention or a test moving forward in pregnancy, my intuition strengthened.
Yep. Amen. Oh my gosh. Yes.
I felt it every single time. The glucose tests, or the certain antibodies, or this, or genetic screening. It was like, no, no, I trust that my body knows what it's doing. And then as soon as I did, it was like the volume turned up on my intuition and my body's ability to communicate with me, and I just had to continually attune for that. So really the rest of my pregnancy was about preparing for a home birth. I felt very confident in wanting that after so many years of being disenfranchised, I guess, with these medical experiences that had really not led me anywhere. I had also had this one time where I went to the hospital 3 times in a week saying something's wrong with me and I don't know what. And they sent me home telling me to take Advil or Tylenol or go to a physiotherapist. And it turned out my appendix had ruptured, and I was walking around with it having been ruptured. And fortunately, it somehow did this weird thing where it pooled all in my low back. So my presentation was extremely bad low back pain, and they were just dismissing. So it was all of these times where I felt like, I had these experiences that really were swept under the rug because they look young, healthy, I'm athletic, I'm fit, right? So it's like I didn't get taken serious, and I'm a woman. So you don't really get taken seriously until you're there, and they're like, well, why didn't you come in sooner? I'm like,
If you take a look at my chart real quick, I just
yeah,
I just there are so many
exactly.
things that you have just said that are just, I think, so important for the mothers listening to this to really grasp. And the biggest thing is this idea of your intuition and the disenfranchisement of, and it's not that getting an ultrasound is inherently wrong. It's not that taking a test is inherently wrong. But when we are put on a just this, conveyor belt, not only in the hospital, it doesn't only happen in the hospital. In our midwife's office,
Yeah,
to the best of their knowledge, they're doing the procedures that are typical. And if we just insert
yeah,
ourselves there and go through without any thinking, without any questions, without any, oh, well, is this right for me or is it not right for me? Then every single thing that we do is just cutting down our intuition over and over again. We're outsourcing. Okay, well, my midwife said this was the right thing to do, so I'm going to do it, and that's that. My midwife does it this way, so I'm going to do it this way, and that's that. Your midwife may be doing it a great way, but if you aren't the one making the decision, if you aren't thinking this through, then you are losing opportunities to grow your intuition, which is extremely heightened in pregnancy. This is the best opportunity to
Yeah.
grow your intuition and prepare you for birth and motherhood. And if we just settle back and think, oh, I did the thing, I hired a midwife. Oh gosh, that no wonder moms
Yeah.
are confused in labor and like, oh, is this right? Is this not right? What should I be doing? Well, we had opportunities that I think that unfortunately even the alternative side of things doesn't realize. Like, no, these are the opportunity. This is where
Yeah.
this is the ground that you forge your intuition on.
And it's so put through their lens too. Like we have to realize this. I mean, I have my own biases. I'm sure you do. We all do. It's human nature. But there were things like, for example, I said to my midwife, I'm not interested in taking the like glucola drink. I will do a test, but I want to do it alternatively. The reason I would do it is because I do know people who didn't fit the mold for looking like they had diabetes or blood sugar issues, and they did. So I'm not opposed to checking on that, but I want to do it in a different way because I don't do well with synthetics and chemicals and medications of any sort. And I said, would you support either orange juice or like an organic candy that equaled the same? She looked at me like I had three heads. She was like, absolutely not. Do you know how my colleagues would laugh at me? She's like, I'm not doing something like that. And then I get an email later on in the week with her saying, "Oh, I talked to my colleagues, and actually one of them does this regularly, and there's an entire there's research studies on it, and blah blah." I'm like, "Yeah, I know. That's what I was asking you." So, you're going through the lens, and like that was going to be something that would impact me and my body that I didn't feel intuitively was going to be supportive for my best health. Where I asked for her guidance on an alternative measure, and she was the most concerned with how that would look for her professional
Oof.
reputation. So, this is why we can't just
Yeah.
follow along blindly. And honestly, I could tell you five more stories much like that through my experience. But yeah, the greatest clinical tool we have
Mm.
is a woman's intuition when she's
Yep.
attuned to it. And we are not utilizing that. And actually, it's being slowly stripped away from us. So,
Wow. Oh my
yeah.
goodness. Well, that was heart to heart. I'm right there with you. That was beautifully, beautifully put. So, okay, so you're having this struggle with your midwife group or your midwife or midwife group, and you're working through seeking
Yeah.
to increase your intuitive understanding throughout this pregnancy. How does that kind of unfold towards the end?
Yeah, so I felt really good. I felt really confident in the fact that I wanted to have a home birth. I felt really prepared. I spent the better part almost every night kind of rehearsing, visualizing, hypnobirthing, creating the scene. Made a podcast. I had a bath because that was really my safe spot. It was where I wanted to birth. I really rehearsed all of it. And I felt really good. There was not really much fear going into late third trimester. Obviously, there was a push around induction when I went over my due date and all of those things. And I just kept telling them, like, you can schedule it. I'm not coming. And they're like, well, you might change your mind the day of. I'm like, I won't. They're like, well, we're just going to keep it. I'm like, you should give it to somebody else. So really, I was up, and this is the thing too. They were like, okay, well, your 42 weeks is on a Sunday. Because it's a Sunday, we actually want to book you in. We want you to deliver on the Friday because there can be less doctors available on the weekend, and it's actually a long weekend. So we think you should do it on the Friday, but because you might go in, you don't immediately go into labor, it can sometimes take 24 hours. We actually think we should induce you on Wednesday. So now their policy was that I couldn't go over 42 weeks or they wouldn't support me. My 42 weeks was on Sunday, but they wanted me to be induced on Wednesday to fit the scheduling of the long weekend and everything else. And I, again, just had to say, I'm not altering when my birth happens and when my baby comes into this world for the long
Hmm.
weekend plans of the doctors. That's not happening. And I did feel this kind of itch of like, I'm feeling the pressure. Do I try to expedite this process? Do I try to use castor oil or this or that? And I thought any measure to induce is not natural. if I want to do this natural, all of these extra things aside from maybe ejaculatory sex, everything else is not necessarily, it's chemically trying to spur this along or whatever. So yeah, I kind of wrestled with that a little bit, but I just kept falling back into like, my body's gotten me this far. I got to trust it. I got to trust the process. And the day that I'd given myself, the Wednesday that they wanted me to be induced, was the Wednesday that I actually went into
Wow.
labor naturally. So even more like, I'm not coming, it's happening. And yeah, I think I had prepared so well for visualizing the labor and the delivery, and I fell short of planning and preparing for
Mm.
what comes after. And that's where, in my birth story, things took a turn. It was when the midwives came and when everything happened. So I don't know if
Yep.
that's a direction you want
Let's
to
take
take
it
this,
that
but we can.
direction.
You're
Go.
like, immediate yes. Yeah. So, I mean, I started into labor throughout the day. I started at 9ish in the morning, and I labored all through the day with my contractions and things like that, and into the evening. At the evening, maybe around 9 or 10, I felt like it upticked a little bit more. I called my doula. She ended up coming. And, I was really in the laboring process for quite a while. I was sure I didn't really want too many people there. So she was just there, and obviously my husband at the time. And that was going well. It was taking longer than I had expected. I don't know what I necessarily expected, but it was a bit of a marathon in that sense. I think around 2 or 3 in the morning at this point, I said, let's call the midwives just to see where I'm at in terms of dilation, because it feels like my progress is stalled. So the midwives came. She did a cervical check. That was the only one I ever had at any point in my pregnancy. And she had said, you're about 3 to 4 centimeters. And I just thought, oh my goodness, like that felt defeating. But I was adamant that this was how I was going to do it. I was stubborn enough to see it through. She did say, though, when she did the cervical check, she felt that there was some adhesion of scar tissues. Now, in university, I had a LEEP laser procedure, so I don't know if that created some scar tissue. So she said basically like there was a string of scar tissue kind of holding things in place. So she ended up kind of like breaking that, I guess, a little bit when she went in and did the cervical check. She ended up leaving and said, call us when you're progressing more and when things are really kicked up. So fast forward a little bit, my doula's like, okay, well, I think if you like, I'm going to go home because it's going to be the morning soon. This was maybe 4 or 5 in the morning. I'll get my kids up for school. I'll get them off for school and I'll come back to you. And I remember saying, okay, but can you just wait a couple minutes? And I went to the bathroom. I had this urge to, I think I was pooping and puking at the same time. And I felt like, I know that she told me like, that's transition. When that starts to happen, this is transition. And I just had this intuitive sense of like knowing what my body needed. So at the time, as my husband is holding the puke bucket for me as I'm on the toilet, I said, I need you to do something for me. And he's like, what more do you need? And I'm like, this one's not good, but I need you to do it. And don't say anything. And he's like, okay. I'm like, I need a butthole massage. I don't know what it is. I'm like, something is happening where I cannot uncontract. It was more my perineum, but that's the best I could articulate it at the time. And so he's like, okay. So, anyways, I go lay down. I give him some like coconut oil. I'm like, just all around the area, just whatever. And he does it for 5 or 10 minutes. He's not really saying anything. I'm not saying anything. And then I'm like, that's enough now. Immediately, my body was just like, you can stop. And he's like, okay. And then my doula walks in just within 30 seconds of that. And she's like, okay, I've got everything together. I think I'm going to go. And immediately my water breaks, but neither of them are aware. And I'm like, you can't go now. She's like, why? I'm like, because my water broke. She's like, when? And my husband's like, when? I'm like, right now. And then immediately things transitioned. It picked up, active labor started from there on out. My birth pool was kind of too cold. So I went to my bathtub, and it was just a natural intuitive thing. Like there was no controlling it. There was no someone telling me when to push. My body just knew what it was doing, and it was full force. Like there was nothing that was going to stop that. So as my baby's coming down and I feel it, I'm like, his head's close, like his head's starting to come out. And they both look at me like, what? And, I'm like, to my husband, I'm like, can you feel that you also can confirm this? And he was like, again, slightly mortified, but trying his best to do everything that he knew I needed. So he's like, okay. He's like, wow, there's hair. So yeah, he definitely was like, it's happening. So then I heard them kind of over talking of like, should we call the midwives and whatever, like we should call her. And my instinct was like, if I can get away without calling them, perfect. Like that is what I wanted. I was trying to just be sneaky and quiet and not really like alert to my plan. Um, but they ended up agreeing and sort of letting her know. And I just continued on. Now, this is sort of where everything took a turn in a sense. I ended up, I guess she came, the midwife, and I don't really recall this because I'm in the last final like 3 urges. I end up having a fetal ejection response. My baby just is shot out of me. It's great. But at that point, all I remember is like the intensity and the ring of fire and my baby coming out. And I just go to pick him up gently out of the water. I'm trying to lift him out so nicely. And in this time, the midwife has come. And so I birth him and I'm like, he's here because no one's in the room with me. I look around and nobody's there. The midwife had asked my husband to find a mask at this point in our own bathroom, in our own house, weeks after she'd come back from a European vacation because it was policy. So he missed the birth.
Gosh.
And those two, my midwife and my doula, were not arguing, but probably like communicating. She was advocating for me, and my midwife was wanting to take over control of everything out in the hall. So I'm just peacefully like bringing him into this world, and I'm like, he's here. And then all I hear in my ear is, get him out of the water. He's going to
What?
drown. So that's how things transitioned. And so I pull my son out onto my chest and I just hear like, we need towels, we need towels. I'm just getting these towels like thrown on me in the bathtub. And the midwife is just, I will say, neurotic and probably someone used to feeling more prepared. And I didn't give her that time. She immediately came into it. So I don't know. Half of me wants to give her the benefit of the doubt. Half of me is like, this is your job. You should know what's going to come, and it shouldn't put you into this much of
Yeah.
a fight
Mm-hmm.
or flight state. So really, that is sort of the start of it. She ends up throwing all these towels on me. She ends up immediately looking at me saying, I think your baby swallowed water. We need to aspirate him. And within seconds, she's, suctioning him and stuff. And I'm just sort of in this state of shock. Like I needed 2 minutes here at this point. And so she's like, okay, we need to get you out of the bathtub. The baby's going to be cold and we need to get you into your bed and come on, let's go. And I'm kind of like just shell shocked at this point, being like, in the last 30 seconds, you've suctioned my baby, you've rubbed us both down, you've been screaming the whole time frantically. So we get up, pass the baby. I don't even exactly know how. Anyways, get over to my bedroom and into the bed, and it's immediately like, we need to cut the cord. We need to do this. This is the next step, blah, blah, blah. And I'm like, I just need a minute here. And I told her, I'm like, I can feel the cord between my legs. I can feel it pulsating. I'm not allowing you to cut it. And at that point, my doula was like, she needs 10 minutes. Like, can you just give her at least, well, even 5? Like, I remember her just like fiercely telling the midwife to just back up and get out of my space for a second. And so, yeah, I'm doing skin to skin. It's going well. He's like nursing and everything, and she keeps kind of popping her head in the room, being like, we really need to get this started. Like, your cord has to be cut. It's been 14 minutes or 18 minutes or, just sort of tallying up. And at some point, both the doula and my husband are like, yeah, the cord's white now. Like, I think you're probably good to go. So she starts that process. And then she's kind of doing whatever she's doing at this point. Again, I'm focusing on my baby. And she's like, the placenta doesn't look like it's coming out. Can I try cord tractioning? And I was like, well, does it have to? She's like, if it's not birth within 30 minutes, we have to call 911 and transfer you. And I was like, I feel like this has been like 5 minutes since I just gave birth. Like, and so, she's really like, if you don't do these things, like we have to send you off. And then my husband is sort of fearful of that. And he was like, well, you don't want to have to go to the hospital right now. Like, and then obviously I have my doula being like, well, I have this herbal remedy or this or this, or like, and the midwife is just trying to like shut my doula down hard at this point. So she cord tractions. She doesn't get anything. She's trying a fundal massage. And she's like, I really think we need to do Pitocin. And I was like, I don't want Pitocin. She's like, look, your son's already cut. He's not going to get any of it. Whatever. It's this or I call, like, it's up to you. It's this or I call, to get you emergency transferred. And so I looked at her and I said, I'm super sensitive to medication. Like, I do not do well with medication. This is one of the reasons why I don't want to take this. If you want me to try it, I will try a half or a quarter dose to start with. And she was like, I can't do that. I'm like, what do you mean you can't do that? She's like, how could I give you part of a dose? I'm like, is it in a syringe? And she's like, yeah, it's in a 10 mil syringe. I'm like, so administer half. Like, I'm not sure how this is challenging you, but and she's like, well, that's not really policy. And I'm like, well, that's all I'm consenting to. So that or nothing. So again, not what I wanted to be doing. And I didn't prepare myself for after the birth, the placenta piece. I just didn't know. And so I'm very cognizant and aware up until this point. I mean, I'm arguing with her on how to deliver half.
I'm arguing with her about third grade math, so kind of in it.
So she agrees, fine, I'll give you half a dose. Once I give it to you, immediately we're getting up and we're walking to the bathroom and you're going to sit on the toilet and see if you can birth there. I said,
I'm just
okay.
curious. I'm
So
just really
I
curious. Jess.
recall
Did
her.
she not like, was there no like, hey, maybe get up and try squatting or like anything before? What
No,
is, I just don't
nothing.
understand this kind of stuff.
It was from you're laying in your bed to do a shot of Pitocin and sit on the toilet. And we need to get you back in the bathroom now.
And we can't try the other thing first. We can't try it without the Pitocin first. Like, that's just wild to me.
Yeah. Yeah. And again, I had already sort of told her about what that I was going to not do any of the routine things. I would see how it goes. And, she fear mongered me with the exact
Uh-huh.
situation that ended up playing out. And so I remember her giving it to me, and then, her on one side and my doula on the other side. And they're like, okay, we're going to just like walk together now to the bathroom. And yeah, I wake up on the toilet and a different midwife, I guess the backup midwife, has now come at this point. And she's like, hi, like, I'm blank. You just fainted, but you're okay. Like, you're on the toilet, you're in your own home. And quickly I'm like back to it. I'm back with it. And I'm like, okay. And they're like, yeah, we think you're like hemorrhaging. We think your body's in shock and all this stuff. I'm like, we need to try to get an IV on you. Can you come off the toilet and lay on the floor? And we're going to try to get an IV. I'm like, okay. So I move down to the floor in case that happens. And yeah, she's just basically trying to get an IV on me, missing every vein. I think she tries in both hands, both feet. And then the original midwife is like, I can see blood clots coming out. Like, and then she just starts tractioning again. And at that point, more blood comes out. And so she's like, she's like, she's on the phone to 911 at this point and etc. And so she's like, we really need to get fluids. They're talking to each other. We really need to get fluids. I'm like, I can just drink fluids. I'm okay. Like, if you're not pulling on me or poking me, like, I'm fine. I can drink fluids. She's like, are you crazy? You might be going in. You're probably going in for surgery now. You can't have fluids. I'm like, if I have fluids, like, I puke water. I'm with you guys. It's fine. I trust your resuscitation abilities if I throw up water. She's like, you cannot have water. So anyway, she walks out of the room again. She's still on with emergency services. I had a smoothie from when I was laboring before. So I just drank the whole smoothie right then and there to get some fluids into myself. She came in catching me on the tail end and of course yelled at me that like, you cannot be eating or drinking. And so she was like, we really need to get this placenta out. Like, this is becoming an emergency situation. I think you've lost 500 milliliters of blood, maybe. I can't be sure. And she was like, we need to do it again. She gives me another dose of Pitocin, and this is as so emergency workers are coming in, firemen. At this point, I'm naked. There's blood, obviously blood all down my thighs. And they go to wheelbarrow carry me out, the four firemen. And I'm like, hello, can I have some clothes? And they're like, oh, it's fine. It's nothing we haven't seen. I'm like, I'm going to be in the hospital in a minute. And they're like, yeah, you'll get in the hospital again. I'm like, and then what do I do when I'm going to go home? Well, someone can bring you clothes. I'm like, or you could just allow me my dignity and let me put on a nightgown right now. Thank you. So they're like, fine. So I had a hospital bag just in case anything happened. I get dressed and they're like, we really need to try this again. Like, just let us do one more shot. She does one more shot of Pitocin. Of course, within 3 steps walking beside these firemen, I faint. And then, yeah. And then I'm awake again as I'm going out of my house being carried by all four limbs, essentially. And by the time I'm into the ambulance, I'm totally coherent again. I'm back with it. I'm good. And the midwife is frantic. And she's like, Did you bring your health card? We need your health card number. And I'm like, no, I didn't pack my health card when you were carrying me naked, unconscious out of the. So I'm like, I know my health card number. So I'm in the ambulance again. This just speaks to my cognition. I'm reciting my health card number. She is losing her mind over not having a blue pen because it's policy that she writes in a blue pen. And she doesn't have one. Anyways, she wants to give me more medication on the hospital. She wants to stop the ambulance to give me an IV. So it looks like she was able to get the IV before we get in there and yada, yada, yada. End up getting to the hospital. It's not much better once it gets there. I'll spare a lot of the details, but one of the things which I still have not complained about and want to is I'm in the hospital and I am saying, they're like, okay, you need a double blood transfusion. We need this. I'm like, has the blood been vaccinated? Do we know this? And they're like, you can't like demand these things. I'm like, no, I'm not. Like, go and check and whatever. They didn't end up having the information I wanted. But at the same time, I'm like, okay, I'm freezing in this hospital now. Can I have a blanket? She's like, oh no, you're not freezing, you're in shock. I'm like, no, I'm cold. Like, whether I'm in shock or I'm not, you're putting cold fluids into me right now and I'm cold. Can I have some blankets? And it's like, wow, we've got to deal with saving your life first. I'm like, my life is fine. you Again, you've got me spread eagle towards a clear door into just the emergency room of the hospital. Like, could I please have some blankets? And they're all doing their tests, they're all doing their things. Each one of them is prepping me for surgery for a DNC. And the surgeon, OB, comes in and without consent, without informing me of what happens, nothing. I feel one nurse hold my hand and she's like, squeeze my hand. And then my midwife come to the other side and she's like, yeah, squeeze mine too. This is going to be uncomfortable. And the doctor puts her hand inside to see if she can try to manually pull my placenta off the wall. I don't think I tore during my birth, but I had third-degree tears after, and I don't know if it was from that or from my surgery. But I was very aware when I was delivering where I was tearing and how much. It was anterior that I was tearing because I could feel it, but very minimal. Um, and so when I came out of surgery, sutured all the way to my anus, and including that, I was in quite a surprise, specifically because I said going into surgery, I'm having my placenta encapsulated, so please return it to me. And I do not consent to grade 1 or 2 being sutured. And I will write those things down unless I've severely done something that I'm not aware of. But, considering I felt some of the tearing, I'm pretty sure I would have felt the other tearing. So I came out, the placenta had been lost, quote unquote.
It was just lost. We just don't know where we put it. Like, what?
Whoops. And so the placenta was lost. They later found it in formaldehyde, so it was ruined, and I was stitched. So yeah, just a bit of the
Jeez,
backstory of the
Jess.
birth there.
Wow. It's so frustrating to hear how all of this preparation, all of this intention and desire to follow your instincts and your intuition, and it does seem like in some ways it just makes me wonder, is it because of that that your midwife was on such high alert? Is it because of that that you were treated in certain ways that maybe if you had just kind of quote followed along and played the game, maybe those things wouldn't have happened the same way? And that's a very disturbing question to have to ask.
Yeah, yeah, totally. And, it leaves pieces. There was stuff that now I wish I would have learned more. I think I was a good advocate for myself, and it got me to the point of everything that I'd focused on, right? Until that cord is cut and my baby's on my skin, like, here are all the things I'm preparing for. But I didn't think that the amount and in the ways that you could be treated afterwards were
Yeah.
even things that would come up. So yeah, if anyone's listening, just yeah, a due diligence to the
Yes.
entire process. I had my birth plan, of course. I had my, I've been very aware to tell her, like, this, I got my placenta encapsulated, I got this, I got that, like, this is all taken care of. But honestly, they didn't really
Yeah.
care.
Mm-mm.
once once it was in their hands and it was quote unquote emergent, then it was up to them. And even later, I remember going back in for a follow-up, and I said, I'm having a lot of, like, pain to go to the bathroom and things like that after. And I believe, stitched all the way from my like my whole perineum, and my anus actually has stitches in it as well. And they were like, oh no, that's just hemorrhoids. I'm like, no, I'm pretty sure they're stitches. Like, can you just confirm that they're stitches? And she's like, well, I don't need to see. I see enough of this all the time. I just know it's hemorrhoids. And I was like, I am going to tell you again that I'm pretty positive I'm stitched. Can you please do an examination? She was like, well, I really don't think I need to see it. I'm like, well, can I send you a photo then? At a minimum, can I send you a photo and you can confirm? Send her a photo. Oh, yeah, that's totally stitches. Yep, those are
Well,
stitches.
thank you.
So, and when I said again, like, after again, I don't tolerate medication. I know that I fainted because of the medication. It was, no, you
Yeah.
fainted because you were
Mhm.
hemorrhaging. We had to save you. And I was like, I
Yeah.
wasn't hemorrhaging until you started injecting me with medication that I
Yeah.
told you I wouldn't tolerate. Nope, that's not the case. So
Mhm.
there's a lot of gaslighting that goes on, even when you are an
Yeah.
advocate for
Yep.
yourself as well.
Absolutely. Gosh. And I feel like with you having had this experience, seeing how it can be, even when you are advocating for yourself, that probably does give you like an extra level of desire to support other women in their health journeys, both, pregnancy and otherwise, like, just with autoimmune as a whole and the things that we have to work through. That sense of like, I know what it's like. I've been there. I've experienced it with autoimmune illness. I've experienced it through pregnancy, and I want to be able to provide this to other women. Do you feel like that plays into it at all?
Yeah, absolutely. I think so many of the things, I know that I'm going to choose something that's different than a lot of women, or, you know, certain things I may be further down the spectrum. And I actually don't,
Mhm.
I do care, but it's not up to me. And I don't think I have any place in
Mhm.
the decisions that my clients would make in their pregnancy. But I'm passionate about that they know the risks and they're told all the information on both sides, because no one is going to have to bear the results of any consequences that happen other
Mhm.
than that woman. And I have a lot of women who have had complications with Zofran or birth defects or different things that have happened,
Mhm.
and they just weren't told, right? And it's so, I kind of toe this line of, I don't want to fear monger women, but I also want you to know that there are risks to the
Mhm.
things, even for an ultrasound. The amount of women that I've had when I put up polls that have said,
Mhm.
I miscarried within days of my early dating ultrasound. And it's like, no one tells you that there's a risk to that at all. And then you're the one left thinking your body is broken, something's wrong, etc. When really maybe the stress of the high sound frequency, the heat, the etc., the skill of the ultrasound technician, maybe all of those made it too stressful for the fetus. So yeah, that's like, again, my role is to help educate and share as much of the information as I have been able to come up with and find through my research, and then trust that a woman is going to make the decision that feels the best for her.
Yep, exactly. I think that that's when I think of what is my role, what is my desire when it comes to supporting women in their pregnancies, like whether they choose home birth or not, the biggest focus is that each mother feels the confidence to make the decision.
Mm-hmm.
Not that you have to make this decision or that decision or that your decision needs to look anything like mine. I don't really care. Like, I
Yeah.
really just want you to have that sense of autonomy and authority and recognize that you have the ability to make decisions. You were put in this position for a reason. You can do this. You are somebody's mother. You can make decisions and you can do it confidently. Check the research, check your intuition, but you are able to make those decisions. And it sounds like that's very much the same spectrum that you're on. And
Yeah.
it's critical. So let's go back to HG.
Okay.
Can you explain for those who haven't experienced it as you have, what it is, what it's like, and why this has become so important in your work?
Yeah. So HG is a severe form of morning sickness. There are a lot of people who don't like that term to be used synergistically or interchangeably, but so many women and even doctors still don't know the term hyperemesis gravidarum. They are just saying, this is morning sickness, you're just less tolerant of it, pregnancy seems to be harder for you, etc. So there really does need to be more awareness of it in the first place. But what's happening is that the levels of nausea and vomiting are debilitating. So oftentimes it's 3 or more times a day that you're being sick. It's impacting your ability to eat or drink, which is causing you to actually lose weight. And the percentage of weight loss is determinant of the severity of the HG. And it's just something that takes you away from being able to participate in your life. I kind of describe it as that feeling before when you have a flu and you know you're going to be sick and it's kind of like 5 minutes before you're going to throw up and you're like, oh, I know I'm going to be sick, so I should probably go to the bathroom, but I also don't even want to move because the second I move I know I'm going to be sick. It's that feeling all day, except for when we have a flu we get sick and we sometimes have 20 minutes, an hour, 2 hours where we feel kind of good again, and then it slowly builds back until obviously we've kind of let that run its course. But HG doesn't really feel like that. It's just that's the consistent state. And I remember keeping a countdown of like, okay, I've thrown up 47 days in a row now. I only have, I don't even know, like 130 something more to go or whatever the numbers are, right? And I just felt so defeated of like, how can I do this for this many more days? I'd already lost close to 20 pounds. Um, again, I wasn't really getting any root cause solutions or answers. And yeah, I was just fortunate enough to know one other person in my local community and in my online space who had experienced this before. So I knew kind of her experience, and she had a quite severe case on her last pregnancy too. So I had a little bit of a resource to reach out to. But had I not had that, I probably wouldn't even have known that I had HG, maybe till my third or fourth hospital admission. So yeah, that really is sort of the description of it. For a man, I say like imagine being hungover every single day. You wake up, it's just over and over and over, because they can't also really comprehend. No one really can until you're in it, because again, it sucks to be sick for a day, but
Mhm.
you have some reprieve. When you've been sick for a week, 2 weeks, a month, and you have no end in sight, it's a really dark place to be in, because you don't like, what is the point, and what's the point of, how can you even be excited when it's pretty much killing you, it feels like, to go through the pregnancy. So yeah, well, first off, when I was able to resolve it for myself, I wanted people to know that that was possible. And I went to some of the bigger organizations or advocacy groups and sort of shared some of my things, and my comments got blocked. My midwives were like, oh, cool, that's pretty much it. Similar when I kind of had resolved some of my autoimmune issues, it's like I thought like, hey, everybody, I've figured this out. I've cracked the code. Like, come around. Like, let's collaborate on this. And everyone was like, oh, we're kind of doing our own thing, and we don't actually want there to be a cure. So shh, stay in the corner, please. So that really hit me. And then it just sort of, became like, do I become visible on social media with this? And through my education and my credentials and stuff, not really supposed to, but it's like, do I serve those policies and those boards, or do I serve women?
Mhm.
And so I just had this epiphany of like, it's going to be women who save women and
Mhm.
heal women, and we're
Mhm.
going to do it outside the system. And that was all of my HG work was born
Mhm.
from that.
Gosh. Well, and you're talking about getting to the root of these issues. So how, like, what does it mean to you, and what did it look like for you to truly get to the root of HG? What kinds of things were you doing, putting into
Yeah.
practice?
Well, for me, I ended up realizing that the medications that were working were part antihistamine. They were part B vitamins, and then Zofran also worked, and it was a serotonin inhibitor. So I
Mm,
was like, okay, I know that there's a component around histamine. So what can I dig up with that? And that really led me to kidney function. And
mm,
then I know there's a part around this B6 piece, or it's one of the contributing things. So then it was like, okay, well, if am I getting adequate amounts in? If I am, how can I know that it's being absorbed? Or do I have a methylation issue where maybe my B vitamins they struggle a little bit more? So it's kind of like digging down that rabbit hole. And then with the Zofran, it was like that is impacting the serotonin receptors in the gut. So is there a gut health component that I could be addressing here as well? So with that, I kind of put a plan together. I reached out to some doctors. I did a lot of research. Looked for research papers in those areas. Of course, none of them are going to be applicable to pregnancy in this way, but everyone always asks me, like, do you have the research papers? Like, do you have this or that? And I'm like, well, I have one that's loosely correlated, and then I made all my own inferences to get from point A to point B to this next paper. So it was kind of, yeah, just I always tell women, like, every clue or everything that we know is a piece of the puzzle, and the more pieces that we have, the clearer the image is.
mhm,
So we know, like, if I have 6 random pieces of a puzzle, I don't actually know what's the puzzle. Like, is it a picture of an apple? Is it a dog? Is it a beach? I don't know. But if I have like 50 of the 100 pieces, I can make a bit better of a guess with that. So it's kind of about pulling together any piece that we can find and then putting together the plan. And obviously, just gotten a lot more refined at that over the last
mhm.
3 years of working with clients to do that. But that was really kind of where I started. And it looked like changing my diet, adding more supplements, giving up my beloved Berkey water that I thought was going to be the end all be all for me and helpful. So, yeah, there was just lots of different little pieces that I put together.
Oh, wow. That is so interesting. Okay. And then also, I know that you've talked about, like, just when we were talking back and forth, some of this work really stems around the nervous system for you at this point and trauma healing. How does
Yeah.
that correlate to what you're doing?
Yeah. So it's so interesting when I try to explain, like, when people are like, what do you do? I'm like, well, I don't know exactly because I self study all these areas and then I piece them all together. So I learned about traditional Chinese medicine when I was doing my acupuncture training. And that really taught me a lot about the organ systems and the emotions of different organ systems. And, for example, the liver it governs emotions around anger and irritability and rage and resentfulness, and the kidneys around fear and worry and like indecision, or like feel like you're going to be left behind. You can't kind of progress forward. So I learned about all these different emotions. And then I also ended up learning German New Medicine and how to work with German New Medicine, which, if you don't know the story, is the Coles Notes version is this oncologist doctor ended up losing his son tragically, and he had a diagnosis of testicular cancer within a number of months. And he thought it was quite unusual because he had always screened himself working in cancer and had no signs of this leading up to it. Then he started to communicate with other people who had testicular cancer as well and realized that they'd all had some traumatic loss. And so then he thought, well, maybe there's something deeper to the emotional experience. And he ended up mapping on the brain these marks that almost look like a water drop onto the surface of water, like these little ripples. And they correlated with the area of the body that would get the cancer. So he ended up going through his career looking at brain MRIs and predicting ahead of time or accurately diagnosing the cancer that the person was going to get based on the location in the brain of that marker. And so he realized that all cancers had an emotional or traumatic root cause to them,
Mm,
and proved essentially that no cancer has really been caught in transit. So when we have, say, a lump in our breast and we get told about this, and then all of a sudden, a few months later, we have metastasized bone tissue, the one didn't spread to the other. It was a secondary insult of finding out that you had cancer. And now the body was playing out this like removal attempt. So the body was either in his work was either always going to add tissue or take tissue away based on what it felt you needed. And there was these different conflicts that you could kind of use. So then there was the German New Medicine piece. And so now I'm kind of pairing together the traditional Chinese medicine, the German New Medicine, and I just started bringing it to my clients. I'm like, okay, through my lens of like Western take, this is what we would see at this organ. Through the lens of a traditional Chinese medicine practitioner, it would be this. And through the German New Medicine, it would be this. are any of these landing for you? Like, what's your intuition saying back to you? And I would just sort of follow that. And now, again, I'm kind of better at figuring out, which piece. But I mean, this even stemmed to one client who came to me for not pregnant, a stage 4 liver cirrhosis, that they were like, we're putting you on the list for a transplant. You will have liver cancer at some point and whatever. And as she was like, I don't even know why I'm here. I don't know what you're going to help me with as like a holistic physiotherapist, because she came to my clinical practice at that time. And she was like, but I was told I had to see you. So it was really like, I worked through with her, and we ended up finding out that there's a huge German new medicine piece, was this territorial conflict. She had lost her dad, and now all of her family and her therapist and everything were kind of telling her to get over it. And
Mm.
it was even like coming from, again, therapist and husband at the time. So
Mm-hmm.
there was no territory that felt safe. And so when we worked through that, it really resonated, and it allowed her to make progress on healing, outside of what the medical system said you're going backwards. And, she kind of turned it all around and healed a good amount, and is still obviously on that journey. But yeah, so those are some of the pieces. And then I think when I apply it to pregnancy, it's like I'm seeing that the liver is really one of the burden systems, and I'm seeing that the kidneys are one of the burden systems. And it's how can we implement positive change on one of those organ systems from all angles? So can we use herbs to support? Can we use nutrition? We know that the liver, the kidneys, every organ in the body has specific nutrients it needs. How well are we making sure that you get those in and you're absorbing them, etc.? So like, can we do like nutritional support for that? But then we also know that this is governed by these emotions. So can we work somatically to release some of these emotions so that the total load on that organ is less, and now it can put more effort and energy into growing your baby into functioning properly, rather than being in a survival state during your pregnancy because of the additional load of pregnancy. So that's really been the case. And I have clients who have done some of the nervous system work, and it's the thing that immediately changes their symptoms, like
Yep.
instantly. So it's a little different for everyone. Some people it is going to be the nervous system work. Some people it's going to be the liver function. Some people it's digestion. Sometimes it's kidney. So really, my work is in the assessing for that person what their root cause is.
I love that, Jess. I think it's so neat because it really, in my experience with having Lyme disease, it was I had all these other things going on as well. But as soon as I was able to clear out the massive burden that this one thing was causing on my body, all of a sudden my body had the energy and resource to heal all the other things that were going on. And so it's really special to think that, you're looking, you're assessing, you're thinking of all the different options of like, okay, well, this is what's coming up. Let's consider which one of these, what's the big player? Like, what's the big one we can take down? And once we remove that,
Yeah.
a lot of things are probably going to start falling into place on their own. And I see that happening with trauma, with the nervous system as well. You heal one aspect of trauma and you think, well, that's not related to this other thing that happened. And this other thing is like a really big problem as well. But when you heal this one piece, all of a sudden the other issues dissolve because your body then has the space to take care of the other things. It's just wild how that
Yeah.
seems to happen. And it seems like you've seen that as well.
Yeah. And I mean, I've really been doing that work in the space of obviously trying to reverse HG for women, but
Mhm.
I'm becoming more and more deeply passionate about doing this work preconception,
Yeah.
because your body is going to serve as the blueprint to make this next little human. And if it's a girl, they have their daughter's eggs inside of them while they're inside of you. So you are impacting 2 generations of health at the point of your conception. And do you not want a body that is as free from trauma and emotional suppression as possible, as nourished and replenished as possible, as just like functioning with ease? And it's like we can certainly dig our way out of the hole, when you're pregnant and you're sick, but I'm spent the last 3 years working with my son to try to do some of these things that, had I known prior to conception, I would have been able to create a positive change or avoid altogether. So really, like, this work and this, again, the Chinese medicine calls it your constitution, and you pass your constitution on to your baby. So that's like, there's, genetics for what color eyes will they have, there's hair color, there's whatever, but there's also how will they process anger,
Mhm.
how will their body inherit trauma? Like, how does that impact their ability to detoxify? Because now that's taking out two of the biggest detox organs, or they're burdened from start. And I mean, yes, a baby's going to be born pretty well functioning, but they're going to be at a disadvantage compared to if we did this work ahead of time and really freed up all these resources to go into creating that baby. So, yeah.
Wow, that's amazing. And that's what you're preparing to really focus on now. Is that right? Do you I think you had mentioned maybe you've got something coming that's in that realm.
Yeah, exactly. So I've been working through the what I call the healing hyperemesis or healing HG blueprint, and sort of like a guide to really take you through the process of like, let's figure out what the root cause is. But I, again, with HG is a side effect of these systems being challenged in the body. And it's
Right.
great that we get to alleviate that side effect, but wouldn't it be better to prevent it altogether because we fix the things from the root of the issue? And what I'm seeing, and it's harder to kind of sometimes share this with women, is yes, the HG going away is a great side effect, but so is your baby not being born with tongue ties, or having 2 years of digestive issues or sleep issues, or having asthma when they're 6 or 7 because there was more development that could have been optimized of their lungs in utero, or not having cavities or tight oral like structure because you had adequate nutrition in the beginning of your pregnancy when that neural tube was developing. So
Mm.
all of these things are also the side effects of your body not being fully well resourced ahead of pregnancy, and we don't even realize the savings of pain and suffering that we're doing by doing this work ahead. So, yeah, my passion has really shifted into the preconception. I'm about to launch in the next coming weeks a the human blueprint, and it is all about how to create your body in a way that's going to serve to be the optimal blueprint for your future baby. So, you can't build from what you don't have. You cannot give your baby resources that you don't already have in your body. And so it really is a plan to optimize that ahead of pregnancy, through different phases, through rhythms and biooptimization, to detox work, to replenishment work, and an 8 week out kind of nutritional protocol to maximize the reduction of neural tube risks. And we think neural tube is like, oh, just spina bifida, but it's not. It's tongue ties, it's colic, it's digestion, it's tight oral tethers all the way down the midline, because when that was developing, there wasn't enough resources to fully carry out that process. So that happens actually 8 weeks to 90 days ahead of conception. So this is why I'm channeling more efforts into that, because I just believe like we all want to do the best as moms, but we're not told. And if I can create education and awareness around like, you spend 3 months doing this ahead of your pregnancy, you're saving yourself a lifetime of challenges potentially. So yeah, that's what I'm working on right now.
That's incredible, Jess. And as we come to a close here, how can people get in touch with you? I know that you said you've got some rebranding stuff going on. We'll be sure to keep the show notes updated for whenever that comes so that people can constantly get in touch with you. But for now, where can people find you? How can they get in touch to work with you?
Yeah, so right now, pretty much everything is centralized around Instagram. The underscore wellness underscore element is my Instagram. Again, once I have the okay from the lawyers to go ahead with the new name, I will definitely share all of the details. And everything that you need is pretty much there. I do have a podcast, although it's pretty minimal, but that's called the Wellness Element Podcast. And just even in the, handful of episodes that are on there, I really think that that is enough to give you a kickstart into kind of being able to assess your own health. I mean, one episode is on digestion, like how from mouth to toilet can you optimize this and kind of troubleshoot it for yourself. So there's lots of, yeah, I think really all of my resources live on Instagram, and that's kind of the central point. So if you can find me there, you can find anything.
Awesome. We will be sure to link that in the show notes. Jess, this is so powerful. Your story is incredible. Just your perspective is beautiful to hear. And I know that it's going to inspire so many moms. Thank you so much for coming on the Happy Home Birth podcast.
Yeah, thank you so much for having me.
What an informative episode. As we jump into this week's episode roundup, I have a few thoughts I'd love to reiterate. Number one, Jess mentioned the importance of listening to your intuition, especially during pregnancy. Pregnancy is the time to interact with our intuition and gain an understanding of what it feels like to be in tune, especially if we haven't had many opportunities to exercise this kind of practice before. Next, at the same time, Jess's story also shares the reality that even when we are listening to our intuition and following its guidance, there can be other factors at play that can deeply influence our experience, particularly our care provider. Jess knew what she wanted for her pregnancy and birth, but her midwife was not on the same page, which led Jess to try to advocate for herself while also trying to recover immediately postpartum. As Jess attested, this is not the situation that you want to find yourself in postpartum or anytime in your care. Not only do you need to know what you stand for, but finding a care provider who will support you in that is key. And finally, I love how Jess approaches health by looking at the quote issue or symptoms with different lenses, seeing where those lenses intersect and beginning there. Trauma, illness, nutritional depletion, trapped emotions, they can all be factors. When we can remove some of the biggest pieces, oftentimes the rest begins to fall into place. Okay, my friends, that's all I've got for you for today. Be sure to find Jess and her information in the show notes, and I'll see you back here next week. Thanks for listening to this week's episode. Are you looking to extend the home birth support, encouragement, and education? Join us in our Facebook group, Happy Home Birth Podcast Community, and check us out on Instagram at Happy Home Birth Podcast.